Let's talk about ascites in under 10 minutes. So what is ascites? Well, from the outside you'll see a swollen or distended abdomen. Ascites means that an unusually large amount of fluid has collected inside the abdominal cavity right next to the intestinal organs. But what actually causes ascites? First of all, we divide the causes into two main groups, those related to portal hypertension and those that are not. Portal hypertension simply means that there is too much blood volume and therefore high pressure in the portal vein. Here's the portal vein, and as you can see, it becomes enlarged and stretched. One of the most common reasons for that is liver cirrhosis. In liver cirrhosis, normal liver tissue is gradually replaced by scar tissue. The blood vessels inside the liver narrow and blood flow slows down, and as a result, blood backs up to the area of least resistance, so into the portal vein. In industrialized countries, liver cirrhosis is most often caused by alcoholism or chronic viral hepatitis. In contrast, in middle and low income countries, infectious causes like liver parasites are more common. Let's go back to the portal vein. Besides the increase in pressure, there's also a significant drop of albumin production in liver cirrhosis. Albumin is important because it keeps fluid inside the blood vessels. When there's less albumin, fluid starts to leak out into the surrounding tissues. That's exactly where the Starling Equation comes into place. It describes the net movement of fluid between vessels and tissues. In this case, we can ignore the oncotic and hydrostatic pressure of the interstitial space and focus on the plasma oncotic pressure and the hydrostatic pressure within the portal vein. And in our case, oncotic pressure is reduced due to less albumin, and hydrostatic pressure is increased due to the impaired blood flow into the liver. This leads to net filtration of fluid into the abdominal cavity from the vessels. And at this point, we should also talk about a complication that can occur additionally. Since blood flow is very slow in the portal vein, also small blood clots can form quite easily. These thrombi make the problem worse by further blocking blood flow and increasing the pressure behind the clot even more. Let's move on to another organ. Do you have any idea which one can also cause portal hypertension, but is not the liver? The answer is the heart. In right-sided heart failure, blood can't drain properly through the venous system, so it starts backing up. That happens because the right side of the heart either faces too much resistance or has become too weak to pump efficiently. The most common reason for that is general heart failure due to long-term high blood pressure. So how does this link to portal hypertension? When blood collects in the right atrium and the large vena cava, it eventually backs up into the liver veins, right into the intrahepatic sinusites, and even into the portal vein. And then the pressure increases in the portal vein, like in liver cirrhosis, and the same mechanism occurs, leading to fluid accumulation in the abdominal cavity. How could we spot that? On sonography, we can often see enlarged cava veins, hepatic veins, or a dilated portal vein with slowed blood flow. Now let's move on to the right side of our tree diagram, ascites that's not caused by portal hypertension. And for this, we need to take a look at the kidney. And similar to what happens in advanced liver cirrhosis with low albumin production, patients could also lose albumin into the urine. In so-called nephrotic diseases, which is basically an umbrella term for several kidney disorders, the glomerular filter becomes damaged, and as a result, large proteins, just like albumin, pass into the urine and are now decreased in the blood. Think of nephrotic as protein losing. The O stands for protein and loss. Let's head back to the Starling equation. Again, when albumin is lost, the pulling force inside the blood vessels weakens, so more fluid seeps out into the abdominal cavity. Another common reason for fluid accumulation is acute pancreatitis. That's an inflammation of the pancreas, and it can be very severe and may require hospitalization. If you remember one thing here, let it be this. Acute pancreatitis can cause massive fluid loss, electrolyte imbalances, and even organ failure. It's a serious condition and not uncommonly treated in intensive care units. Most of the time, it's actually a sterile inflammation, which means there's no bacteria or viruses to be found. Alcohol abuse or blocked bile duct due to choledocholithiasis is the main cause. The inflammation can get so severe that it creates a local sepsis-like state, and fluid simply leaks from the pancreatic vessels into the pancreas and the surrounding space, leading to ascites. And last but not least, you should definitely know about malignancy, especially peritoneal carcinomatosis. This type of ascites develops when the peritoneum, the thin membrane covering most of the abdominal organs, is infiltrated by cancer cells. Sometimes it starts from the peritoneum itself, but sometimes from metastases that spread to it. The result is malignant ascites, and red flag symptoms you should definitely remember include abdominal pain or unexplained weight loss. Let's wrap things up and look at one more important cause, but this time again caused by portal hypertension. Since we've talked about cancer, we should know that cancer can also develop in the liver itself, most often in people who already have cirrhosis. The tumor further disturbs blood flow and increases the portal hypertension. The same can happen when metastases reach the liver, leading to the same mechanisms we've just covered at the beginning. An increase in pressure leading to ascites. I know that's been a lot of information, but what are the key points you should take away? Ascites is usually a sign of a serious underlying condition. Remember portal hypertension related causes like liver cirrhosis or malignant tumors in the liver, but also right-sided heart failure. Remember inflammation of the kidney with nephrotic syndrome, so loss of albumin in the urine, and inflammation of the pancreas. Also remember malignancy of the peritoneum, either due to a primary cancer or due to metastases. Alright, that's it for today. Thank you so much for watching, and please feel free to leave feedback or suggest any other topic that you'd like to see on our channel.